Yes. So we'll discuss a few topics from this chapter, which is coming for your test, upcoming test from 3rd of August. Yes. Reproductive health. So if I ask you, can you define reproductive health? What will be your answer? Yes, reproductive health. How will you define? Can you define health first? Can you define health? Yes, no idea? Yes. Well being of a person in terms of a well-being of a person. Who is that? Can you please mute? A well-being of a person in terms of physical, physiological, social aspects of life. Yes. So here, in short, if you want, I can tell health can be defined as absence of disease in human. If there is no disease in human, that means the person is healthy. If a person is healthy, no, physically fit, physiologically the function of the human body from inside, no, biological aspect will be normal. All the systems in our body, respiratory system, circulatory system, reproductive system, endocrine system, all are working normally. Yes, when we are physically fit, biologically fit, that means we are socially behaving. The behavioral aspect socially also, right, it will be normal, no. But here what I told is about health. What is reproductive health? Add up the well-being of the person in the reproductive span of life. Okay. The human life is categorized into three parts, three phases. No? Number one, the first phase is called as juvenile phase. Number two, reproductive phase. And number three, senescence or old age. Three phases of human life. So in the juvenile phase, what exactly happens? It is a growth phase. It is the growth phase. The individual will reach maturity. The individual person will reach maturity. In the reproductive age, since this maturity is reached, the maturity is reached. No? So the person is capable of producing its own young one. Number two. And number three, old age. Senescence or old age means the reproductive span of life is stopped. All the metabolic activity will be getting reduced day by day, day by day. And finally, the person is nearby to the last phase, that is death. Yes. So, maintaining the physical, physiological, and social aspect of life normally, properly in this phase, reproductive phase, is called as reproductive health. Did you understand? Yes. So here there are few problems that arises in maintaining this reproductive health in the reproductive span. What to be done? We need to follow certain strategies, certain steps. Is it clear? Maintaining a reproductive health in this reproductive span is one of the very big challenge. Is it clear? So here, how to plan out what can be done? We need to go with the strategies or planning to have a healthy reproductive span of life. Okay? First and foremost, what are the problems we face? Any idea? What are the problems we are facing? Yes? Very good. Number one, over population, or we can take over exploitation of population. Then, anything else? Yes? That is not a problem, no? I am asking you problem. Yes? Yes. So, the increase in increase or decrease? Both. Decrease. Increase in IMR and decrease in MMR. Now, infant mortality rate, okay, maternal mortality rate. Then, anything else? Disease, number of diseases increased. Yes. Early child marriages. Eh? Yes. So these are the problems we are facing. Number one, overpopulation. So here, overpopulation is because of early child marriage. At the age of 8 years, at the age of 10 years, 12 years, if the girl baby is getting married, that means till she reaches the maturity, no? Till she reaches the menopause, no? Definitely 10 to 12 children she will be having. Right? But here the problem is health will be affected to that particular individual. Is that clear? Then, if we take the population of the world is getting rocketed, okay? And at the same time, the Indian population is also getting sixth time. No, we are in the sixth place. Okay? If there are six people standing anywhere, in that the sixth person will be Indian. Okay? Throughout the world, if six peoples are assembled in one place, in that five will be from other countries, one will be Indian. Okay? 1/6 rapid population is getting fast. Is that clear? So here, first major problem we are facing is over population. Number two, the number of infants are increasing. Why? Every single minute, no? Throughout the world, if you tally, every single minute one baby is born. No? But every single minute one human being is not getting died. No? If you take throughout the world also, every minute one human is not dying. Nay, how many days happened? You listened that particular individual have died. It's very rare. Nay? But if you tally with the hospitals, okay, the ratio is 1:10. If 10 babies are born, no, in 1 minute, only one or two people are getting died. Okay. So that is one of the major reason. The number of population is increasing day by day, day by day. Yes. Number of diseases. Number of diseases. If the number of population is increasing, then the number of diseases also will increase. Is that clear? and simultaneously assume there are 10 children's, 8 children's in a family, ne? But the sole earner of the family is father. No? If there is only one or two children's, no? If a person is bringing 1 kg of apple, no, 6 to 8 apples are coming, that can be shared easily with two children's. Ne? They can eat two. But if there are 8 children's in a family, if 6 apples, if he is bringing, because whether it is 2 children's or 8 children's, he is the sole earner. No? Then if he is bringing that 6 apples to the home, what distribution has to be done? Half, three-fourth? Yes. So it will lead to malnutrition. Proper nutrition cannot be supplied to more number of babies. Right? So because of this reason, the health of the baby will be affected. Is that clear? Then early child marriages, one of the reason because of which the women are suffering from so many diseases. No, the woman is suffering from uterus problem. Okay, uterus problem, ovary problem, vagina. Okay, uterine cancer is coming, ovarian cysts are coming, fibroids are coming. Yes. हाँ, पूरा यूट्रस निकाल डालते हैं, ठीक है. If there is any cyst or fibroid in the uterus, they will remove the uterus only, ठीक है. If there is cyst in the ovary, if it is large, they will remove one ovary, ठीक है. So why this is happening? Because of the health issue, ठीक है. And major everything depends, this early child marriage, overpopulation depends because of lack of knowledge. The diseases are coming, so many diseases are there, but people are unaware. No, they don't have the knowledge about the diseases which are getting spread from one person to another, infectious diseases which are getting spread from one person to another, STIs, sexually transmitted infections, STDs, sexually transmitted diseases. Okay? They are unaware. Simultaneously, so many diseases which will affect the human body, whether it is male or female, no, they are unaware. Because of this reason, so many issues are arising. Now, to overcome this, what can be done, sir? No? So here, first and foremost, we need to provide proper education. Okay? For the children's, to have proper education related to sex organs, okay. So related to the sex related diseases, the government of India has initiated by giving the chapter in your SSLC, okay, in your 8th standard, then PUC level. The purpose is to create an awareness among the individual, the youth which is coming forward. Is that clear? Providing the proper knowledge. Now, sir, if they are uneducated, how, what can be done? No. So here government of India have initiated, no, in India was the first country to initiate this program in 1951, no, family planning program. India was the first country to initiate with this program in 1951, family planning. According to this program, what government of India has told, that hum do hamare do, that means we two our two. Small family, happy family, ठीक है. In order to avoid with the overpopulation, population exploitation, in order to stop with the early child marriages, in order to decrease the number of diseases, what is the first step government of India took? They have taken with the family planning program, we to our two. How they have given this information regarding the knowledge about the sex organ, about the sex related diseases, no. So here, print media, print media in the form of newspaper, no. Then audio video display, audio visual display. So here in the form of videos, in the form of audio in the FM channels, no? So they tried to circulate the message, okay, in the newspapers, in the form of pamphlets. Door to door campaigning was done, okay, to supply the information, to give the information about this. If we don't control the population, each and every individual will be suffering from the diseases, okay. The number of population will increase, okay. If the number of population increases, scarcity of food, scarcity of shelter, so many problems will arise. For that reason, the planning was initiated by government of India. One more, again in 1990, no, one more program was also initiated. Yes, that is RCH program, reproductive and child health care program. Yes, the women who are delivering the baby, proper care should be taken to that woman, because once the woman deliver the baby, after that only, after the delivery, the female will be affected by many of the infections. Okay, if the delivery is not performed properly, later many infections arises in the female. So for that reason, this program was initiated to take care of the baby and to take care of the mother. The reproductive child health care program was initiated by government of India in 1990. Apart from that, government of India also initiated with a band of a test called amniocentesis. Amniocentesis, very important test. Okay. So usually why this test is done? So basically this test is performed to study the chromosomal pattern. Okay. And the purpose, major purpose to study the chromosomal pattern is to identify, to rectify whether the baby is suffering from any of the disease. Okay. But the people of India, they misuse this test by checking. When we check the chromosomal pattern, we get to know that if it is XX, girl baby will be born, XY, boy baby will be born. Yes, gender identification is easily possible. So instead of utilizing in a positive way, the Indian peoples, they started using this, by checking this, by doing this test, by performing this test. So they used to check the chromosomal pattern, and if there is a female feticide, they started aborting. Okay. Therefore this amniocentesis test was banned in India. Still now it is banned in India, but in foreign countries they allow this test. Day one itself they get to know whether after 9 months boy baby will come or girl baby. But here it is banned. Is it clear? To be in a safer side, the government of India has also banned. Then apart from that, many NGOs, okay, non-government organizations, and many non-profitable organizations and other social workers are involved. Why they are involved? To give information, okay, counseling to the people related to sex related diseases, okay, related to the overpopulation, how to avoid. Okay. Now major step what we are using, okay, as an individual, what we are using is, finally we are going with the contraceptive methods. Yes, contraceptive methods. Yes. Now if I ask you what is contraceptive method, what will be your answer? Contraceptive methods. Yes. Tell me. It is like a barrier. Yes. We can tell method or technique used to avoid contraception or pregnancy. Done? Yes. So the number of population can be avoided by undergoing with a major step that is called as contraceptive method. Yes. So here, before going to the contraceptive method, we should study the characters of ideal or good contraceptive. Yes. So whatever the technique, whatever the method we are using, no, it should be good. Nay? Then only we can use. So what are the characteristics? Any idea? It's a 2 mark question. In theory, it will be a 2 mark question. Very important. Huh? Number one, the contraceptive which we use to avoid contraception or pregnancy. Number one, it should be user friendly. Number two, eco friendly. Number three, easily available. Number four, it should have no side effects or very less side effects. Number five, it should not interfere with sexual desire of the partners. So whatever the technique, whatever the devices we use, no, so they have to show this characters. Number one, they should be user friendly. Number two, they should be eco friendly. Number three, they should be easily available. Number four, they should not have any side effect, or if side effect is present, it should be very less. Okay. And number five, it should not interfere with the sexual desire of the sexual partners. Done? Did you understand? Any doubts you have? Any doubts you have? No doubts? Then shall we proceed now with the contraceptive methods? Yes. Now whatever, this is a 2 mark question. Now the topic which we do, it is for 5 marks. Compulsory 5 marks question. You can score 5 marks from the complete topic. Okay? Yes. We'll go one by one now. Yes. Contraceptive methods. Yes. So here, when we talk about contraceptive methods, These contraceptive methods are classified into two types. How many types? Two types. One is called as non-surgical method, and another one is called as surgical method. Yes. Non-surgical method, we can also call it as temporary method, and surgical method also called as permanent method. Done? Yes. Now here we are calling it as temporary or non-surgical because whatever the device, whatever the technique we are using, that is for time being. Okay? It is once use and throw, or for a certain period of time we will use. They are temporary. Surgical, for this method, a surgery is involved. A cut in the human body is involved, required. Because of that, it is called as surgical method or permanent method. Once if it is performed, it is for lifetime. Okay? Yes. Now, coming to the surgical method first or permanent method, this is classified into two types. One is called as vasectomy and another one is called as tubectomy. Vasectomy is performed in males and tubectomy is performed in females. Yes. So what we are doing, a surgery will be done. Okay? Yes. Operation will be conducted. There a cut will be involved where in the males we are trying to cut and tie the vas deferens in males. So the process is called as vasectomy. Similarly, in the females, the fallopian tube, when the fallopian tube is cut and tied, it is cut and tied, it is called as tubectomy to the other ends. Okay? Yes, definitely by doctors and experts. Okay? Not only expert, they should be compulsory surgeon. Surgeon is involved. Surgery, because as I told you, the surgery will be made. Okay? The body will be opened, and after that, here also, when you are cutting this vas difference, no, that vas difference should be tied to opposite ends. Okay? You are cutting this tube, long tube is present. Nee, in the testis part, the long tube is going like this. No, so here if you are cutting, this part will be cut and tied here. This part will be cut and tied here. Okay? So stitches will be made inside also, plus to the outside of the body also stitches has to be made. Therefore it is permanent method. Okay? For the lifetime, once this is performed, there is no chance of conceiving again in the female. Okay? And even male also, because normal life the male can do. Okay? He can survive normally, but unable to reproduce its own young one. Why? Because if there is a cutting and tying here, incision is made here, the sperm which is getting produced, it will go here, come back. It is not able to go there. Okay? There is no space to move on. Similarly, in the fallopian tube also. No? So in the fallopian tube, if the cutting and tying is done here, from the ovaries, no, the ova will reach here, but unable to move here. Okay? So again, it has to degenerate from that end itself. Done? Did you understand? Yes, this is called as the surgical method or permanent. Only two we have. One is called as vasectomy, another one is called as tubectomy. Done? Yes. Now, coming to the non-surgical methods. non-surgical methods. So here we will call them as temporary methods. Number one, we have natural method. Number two, we have barrier method. Number three, we have IUDS. Number four, oral contraceptives. Number five, injectable method. And number six, implant method. So totally six non-surgical or temporary methods we have. Number one, coming to the first one, that is natural method. So here in this method, natural method, we are opting for three different processes. In the natural method, we have three different process. No device, no device, no equipment, nothing is used. Okay? Just by maintaining the time gap. Is that clear? By pausing the time period, this technique is practiced. Number one, we have periodic abstinence. The first one is periodic abstinence. Number two, coitus interruptus. Number three, lactational amenorrhea. Three techniques are involved in the natural method. So here, periodic abstinence. So here what we are doing in the periodic abstinence, the word itself is telling you periodic, no? Time. Abstinence, absent. So here, by seeing the time period, we are trying to avoid the mating between the male and female gametes. So here, the mating between the sperm and ovum is avoided from 10th to 17th day of menstrual cycle of woman. So here number one, that is periodic abstinence. What exactly we are doing? Mating between the sperm and ovum is avoided from the 10th to 17th day of the menstrual cycle. This technique is called as periodic abstinence. Number two, coitus interruptus, withdrawal of penis. Withdrawal of penis before ejaculation of semen into the vagina. Coitus, the meaning of the word coitus is intercourse. Intercourse. Insertion, what is intercourse? Insertion of the penis into the vagina. So here what practice is being done? So before the discharge of the semen fluid inside the vagina, the penis is withdrawn. That means if there is no semen entering into the vagina, there will be no movement of sperm into the fallopian tube and no fertilization process will take place. So this technique is called as coitus interruptus. Then number 3, lactational amenorrhea. No, so here immediately after parturition, after parturition, lactation period starts. Lactation period starts. Once the delivery of the baby is over, no, milking period will start. The mammary gland starts milking. No, the phase is called as lactation. Yes. So until and unless lactation period is going on, no, there will be no menstrual cycle, absence of menstrual cycle. Okay. When lactation is over, very next phase, the menstrual cycle will again start in the female. So until and unless lactation period is going on, absence of menstruals is seen, menstrual cycle is absent, therefore it is a safe period where there will be no fertilization, no pregnancy occurring continuously. Is that clear? Yes. Three phases, three different process where we are not using any device, we are not using any equipments, directly just by managing with the time period, we are opting for three different technique. So this method is called as natural method. Done? Any doubts you have till here? No? Yes. Number 2, we have barrier method. Yes. In the barrier method, again what we are doing? So here with the help of barrier, mating between sperm and ovum is done. So with the help of the barrier, a physical barrier, mating between the sperm and ovum is done during coitus. So here this barrier can be male condoms or female condoms. In the males, we only use condoms which is made up of thin rubber latex used to cover the penis region, so that if the ejaculation happens, that has to happen inside the condoms. Yes, but in the females, not only female condoms, other devices are also available as a barrier. They have diaphragm, cervical caps, foams, jellies, walls, and spermicidal creams. So all these are used as the barriers in the female. Why? Again to avoid the mating between the sperm and the ovum. Yes. When we talk about the male condom, the first condom that was made in India, it is Nirod. Done? Then shall we proceed? Yes. Third, third we have IUDS. Can you expand IUDS? Yes. Intrauterine devices. Yes. So this device has to be injected by the doctors or experts inside the females. This device is used by the females, and they cannot insert this by their own. How they uses the barrier method. No? This method has to be strictly followed with the support of a doctor or the expert in this technique. So here IUDS, the purpose of using the IUDS is to avoid the contraception mating between the sperm and the ovum. So here, if you see the female reproductive system, no? In this female reproductive system, a T-shaped device will be inserted. A T-shaped device is inserted. This T-shaped device, if it's only a device which does not contain any chemical, which does not contain any hormone, just a normal device, a normal equipment, no? Then we will call it as non-mediated IUDS. Non-mediated IUDS. So here, this non-mediated IUDS, when it is inserted, 70% chances are there. After this insertion also, contraception can occur. Pregnancy can occur. Why? The device is blocking here. Completely the uterus passage will be blocked. But what exactly happens? The Siemens, the seminal fluid, which is reaching this device, no, all the fluid will come and deposit here, because after that there is no passage to move. But what exactly happens? You are coming to class. You are very early. In 10 minutes, we will end. Yes. So here, the semen will come and settle down here. No? And the sperms which are microscopic, they can skip and move there. No? Because sperm is microscopic. Blockage of semen is happening. But sperm is microscopic in nature. No? Easily it will move, and if there is egg present there, fertilization can happen. So because of that, only 30% chances are there for avoiding the contraception. 70% chances definitely contraception will happen. Pregnancy can occur. Yes. So non-mediated IUDs. Example for this we have Lippes loop. Lippes loop. Then second. So what can be done, sir? After inserting also, if there is no guarantee, then why to insert? That too with the support of a doctor, the female has to insert this. No. Second option, they can go with the second one, that is copper mediated IUDs. Copper mediated IUDs. So what we are doing in the copper mediated, a string will be added. A copper string will be added to it. So this string consists of copper ions. Okay, copper mediated IUDs. What this copper string will do, once the sperms are entering, no, this string copper ions will suppress the motility of the sperm. It will suppress the motility of sperm. Is that clear? It will not allow the sperm to move forward. The motility of the sperm will be reduced. Is that clear? Movement of the sperm will be captured. Okay? Yes. So example for the copper mediated, we have copper T, we have copper 7, multi-load 375, etc. They are copper mediated, and here 70% chances that contraception can be avoided. 30% chances there also, possibility is there after inserting this contraception can occur. वहां 70 गारंटी थी होती है बोल को 30 नहीं, खाली 30% गारंटी थी सो नहीं होने की. अब यहाँ 30% गारंटी होती है, 70% नहीं होता. ठीक है. सो अगेन टू complete that 100%, no, after the insertion of the device there should be no guarantee. नहीं, complete 100% guarantee we want. Contraception should be avoided, pregnancy should be avoided. So here next device was made as hormone mediated. Hormone mediated. So here in this device hormone is added. Okay? In this device hormone is added. Which hormone is added? Yes. Which hormone? Yes. It can be your progesterone, estrogen hormone is added in it. So what this will do? Yes. At that time, what exactly will happen, sir? 100% chance that pregnancy will. How? Because once the semen is released, no, so the complete cervical region is being hostile. कतो ये पूरा हिस्सा है नहीं पॉइजनस हो गया था. Because of the release of hormone, the complete cervic region is hostile. When the sperm enters, when the semen enters, no, definitely it will be killed. In copper, we are just suppressing the motility of the sperm. In the hormone mediated, the sperms will directly be killed. It will be killed. So example for the hormone mediated, we have LNG20 and one more progesterone. So two examples for hormone mediated IUDs. One multiple choice questions, many a times it has been asked. Okay? So non mediated example, Lippus loop. Copper mediated example, copper T, copper 7, multi-load 375. And hormone mediated IUDs, it is LNG20 and progesterone. Any doubts you have till here? Yes. Next we have oral contraceptive. Yes. So here, when we are using the hormones, which hormones? Progestogen and estrogen. No? These two hormones separately or in combination. Or in combination. Okay? That too in the oral form. Orally, when we are taking this in the form of pill, in the form of pills, when we are using in the form of pill, when we orally consume this, it is called as oral contraceptive. Is it clear? Yes. So here when we talk about this oral contraceptive, the first oral contraceptive that was made in India, right? It was in CDRI, Central Drug Research Institute, no, in Lucknow. In Lucknow. That is called as Saheli. Yes. And this is a non-steroidal preparation. No steroids were added in it. Now the pills what we are having, no, many different steroids are added into that pill for fast action of that pill. But this one was the non-steroidal preparation. Okay. Apart from this, we have many oral contraceptive that female uses. Okay. In terms of board is not visible, what I should do? मैडम को बुलाओ. बोर्ड नहीं दिख रहा, करीम बच्चे वो आप फोकस ग्रीन लाइट आता ना, नहीं आ रहा ना. बैटरी लो. वो बच्ची को उनकी बार बार बोलने कुछ है, मैं तभी से अवॉइड कर, अब वो कंटिन्यू बोलने कुछ है, दिख रहा नहीं करके बोलो. यू आर एबल टू सी नाउ? No. No, battery is down. We can't do anything. Just listen. Is that okay? Done. Yes. So we are talking about oral contraceptive. So majorly it is called as pill when we are consuming it orally. Okay. What is present in this pill? Two hormones will be present. One is progestogen and second one is estrogen, which is separately made or in combination. Both will be present in that tablet. Okay. Pill form. Yes. So here the first one was Saheli. Apart from that, normally available in India, no, we have Mala D and one more Mala N. Okay. Usually these two tablets are being used continuously by the women who are in the reproductive age in order to avoid ovulation. Okay. This is once a week pill. Once a week pill. If you want to skip the period for 1 week, no, this tablet has to be taken. For 1 week, there will be no period. Again, after that, continued period starts. Okay. So till when you don't want to have the period, because so many occasions will be there where you should be clean, and that time period, starting period will be there, first day second day will be there. To avoid that, you can go with this tablets. Okay. Then now one more major reason, in in the conditions where this is normally used, but there are some more pills which are used in the emergency. Okay, emergency. What is that emergency? Couple having sex, unprotected sex. After the sex, they get to know that the semen might have been entered into the vagina, and there are chances for fertilization to occur. Okay, if there is a dilemma there, that doubt case, possibility fertilization happens and it will not happen. Okay, so in that condition, the woman can go with the pill which is called as I pill. Okay, emergency pill, emergency pill. Okay, and a very famous tablet, that is unwanted 72. Unwanted 72. What is the purpose of this pill, sir? Unwanted 72. Before 72 hours are over, no, before that, if this pill is being taken by the female partner after undergoing unprotected sex, no, 90% chances are there fertilization will be avoided. Okay, this tablet will block and fertilization will avoid. Same tablet, if after 72 hours consumed, then only 50% chances it can avoid fertilization, 50% chances fertilization can happen. Is that clear? So emergency pill, unwanted 72, there are many pills. We usually call it as I pill. Is that clear? Yes. This is about the oral contraceptive. Next we have injectable. No, injectable. Yes. So when we talk about injectable, the same hormones, same hormones. Which hormones? Progestogen or estrogen. No, separately or in combination. Separately or in the combination. No, when they are given in the form of injection. No? When they are given to the female in the form of injection, it is called as injectable method. No? Example for this, we can take example of Depo, very famous injection, Depo Provera. Depo Provera, one of the injection which is given immediately. No? Once the couple undergo with the unprotected sex, and they don't want to have fertilization, continue with their pregnancy, that time they can go with the injection called as Depo Provera. Done? Yes. Yes, one more injection is also present by name Sitara. Okay, Sitara. Yes. Now see, the same technique is being followed. Same technique, but combination progesterone or estrogen separately or in the form of combo together. Okay? But instead of giving injection or by using orally, no, a small needle like structure is made. A small needle-like structure will be made, and here, no, near the your clavicle bone, it will be implanted. It will be implanted inside the females. It will be implanted. So what it will happen? Slowly, it will supply the progestogen or estrogen hormone to the body until this is implanted. This implantation can be made up to 5 years. Okay, minimum 2 years up to 5 years. That small injectable needle which is implanted here, no, in the upper hand. Okay, so it can take 2 to 5 years for a woman to avoid with the contraception. Okay, pregnancy will be avoided. Example for this, you can take uh, nor plant or implanon, no? Two very famous implant devices. Implant, it will be very small, like this, in this form, a small needle like. Okay, yes, done. Yes, so today we have studied two very important questions. One is 2 mark question and one more is 5 mark question. Ideal contraceptive, it can be asked for 2 marks, and contraceptive methods, sometimes separately they will ask you explain the surgical method, or sometimes separately they will ask you non-surgical method. Depends. Multiple choice questions will be asked from this topic. Fill in the blanks will be asked from this topic. 2 mark question can be asked from this topic. Also 3 and 5 marks can be. So one, at least one question, compulsory question will be asked from this topic. Is that clear? Yes. So with this we have finished this topic, that is contraceptive methods in this chapter. Okay. First we studied about the problems and strategies that we face in the reproductive health. Then we studied about the characters of the ideal contraceptive, and now we have studied the contraceptive methods. Done? Yes. Shall I stop here? After namaz, shall we continue? Yes. Completely available. After the coming test from this topic, what I have missed, see the textbook. Something if I have missed this topic.